and it's nice to, because, I feel like I have somewhat of a relationship with you. It's a really great experience working with you.
Oh, thank you.
Yes,
That's very kind. Thank you.
And I feel like you jumped right into the program and really tried what you did, and you were motivated, and it was great.
Well, thanks. It was exciting on my part to learn a little bit about PAC Health, but then also to be participating in it.
Right. So even though you and I have talked, if you would just introduce yourself and tell me a little bit about what you do, a little bit about your life.
Okay. Well, first of all, my name is Liz Wertz Evans. I'm a nurse, and I've worked in various nursing positions throughout my career. I'm currently an executive director with the Oncology Nursing Society. I've been there 4 years. In fact, my anniversary was just this past April.
Congrats.
I guess it was last month.
Yes.
So I've worked there for about 4 years. I was working there when this second round of cancer came up. As far as my cancer goes, in 2009, I had a routine mammogram, which I strongly advise pretty much any woman I talk to get your mammogram.
Right.
They found a tiny calcification. I couldn't even see it. Sent me for a biopsy, and it was breast cancer. Mm-hmm. So I had a lumpectomy, had it removed, and I only needed to have radiation. I had 37 treatments for radiation. And I thought I was cured.
Right.
So I was just getting to the 5-year mark. Mm-hmm. In fact, the appointment that I had with my oncologist was supposed to be the 5-year celebration, and unfortunately, it was to talk about the cancer. The breast cancer had metastasized to my liver. I had shown up in the emergency department with a lot of right upper quadrant pain, and they found the cancer was all through my liver. It wasn't even a small tumor that you could just resect it and be done with it. It was, he said it's kind of like a spider web, and it was all through my liver. So I needed to have chemotherapy, no surgery. I had chemotherapy for 8 months, which was grueling. I was admitted to the hospital probably 3 or 4 times because of the nasty side effects from the various chemotherapeutic drugs that they used. The way this whole metastasis thing works is that you essentially get the cancer under control, if you will, but it's always there.
Right.
So there's always the chance that it's going to come back.
Right.
But for now, my scans look good, my blood work looks decent. So I thought, boy, I'm just going to snap right back into where I was when this all started. And that really wasn't the case.
Right.
I was exhausted. I was tired all the time. And I started going back to work probably in October of 2014. I was there maybe 1 day a week. I was falling asleep in meetings. I could not stay awake.
Right.
And everybody's telling me that, well, Liz, to get your health back and to get your stamina back, you need to exercise. You got to be crazy. I feel horrible. All I want to do is lay on the couch all day. Mm-hmm. They said, no. In fact, that's one of our ONS guidelines is for ongoing fatigue, you need to exercise, which I thought was the craziest thing ever.
Right.
And then PAC Health came along.
And you started exercising.
I was introduced to PAC Health, and I read through all the stuff, and it said in there, same thing, doggone it, you got to exercise to feel better. I'm like, I'm too tired to exercise, you don't understand. So Barbara and I were able to kind of go through the steps, and a lot of the stuff I'd already been really familiar with, and, I kind of thought through them and came up with some really short-term goals. But this whole exercise thing, I couldn't get on board. I was told to just walk around my dining room table a couple of times. Where now I am up to 3 or 4 miles a day walking just through my neighborhood.
So wonderful.
Today I walked an 18-minute mile, which I know that doesn't sound like a big deal, but for me, it's a huge deal.
It's huge.
And I I walk maybe 3 to 4 times a week, depending on what the weather is like. But I come home and I really feel good.
Yay!
It's almost amazing. Like, wow, I can't believe they were right.
Right.
And you helped me with that, Barbara. You really did. You really helped me understand the importance of exercise. And I didn't want to be embarrassed at one of our weekly calls and say, no, I still haven't exercised. I know you're telling me to, but I just can't get into it. So you were kind of that motivator.
Right.
That, okay, I know I have to talk to her on Thursday. What can I do between now and Thursday?
So that part of Pack Health obviously helped you a lot, getting you to exercise. Is there anything else about it that you really liked or you thought was helpful?
Well, I think the first thing I liked was having a mentor who, got to know a little bit about me, but somebody like you that was able to encourage me through some of my laziness. I think that was very, very helpful.
Good.
And I liked the introduction. I liked the nutrition piece.
Great.
Because my nutrition isn't all that great because I'm just not hungry.
Right.
I mean, I never thought in my life I would ever say that, but I'm just not hungry. So I have these protein drinks that I drink every day. So even if I'm not eating a whole lot, at least I'm getting some minerals and protein and that sort of thing. The stuff with the insurance, I think that is really extremely helpful for patients that don't understand the whole insurance process. I've worked in the billing piece and the accounts receivable, and I think I understand the insurance piece extremely well. But we're on the phone arguing with our insurer, arguing with the hospital because they haven't submitted it correctly. So it's such a hassle. The whole insurance piece is such a hassle. But I'm blessed to have insurance.
Right.
So for somebody, and I know there are a lot of people out there that they're prescribed a certain drug and they can't take it because they simply can't afford it. They don't have insurance. And some of the drug companies will have a program whereby you can get the drug from them directly for a, kind of a negotiated price, and then they help you. So that part, I think, even though I didn't really get a whole lot out of it, I think it's really, really good for other patients to understand what their insurance covers, what it doesn't cover, and where there are resources that they can go to help with the expense.
Anything else in particular that you would recommend for cancer patients?
Well, I think when you think about patients that have cancer, it kind of goes through a trajectory, if you will. You find out about it, you have the treatment, sometimes you die. Hopefully you survive the treatment and you survive that initial round of cancer, and you're kind of left out there on your own. So during this survivor phase, which is kind of where I am right now, it's like, okay, I did everything I was supposed to. I went to the doctor, I went through all those chemo treatments, and now what do I do?
Right.
And I think Pack Health was very helpful in that survivor mode because it does address certain things that you probably don't talk about with your physician. And unless you have a nurse navigator working with you, a lot of times that ends when your active treatment ends.
Right.
And so you just kind of feel, it's almost like you feel alone.
Yes.
You're out there trying to readjust to this new normal, if you will. And Pack Health came along and said, okay, Liz, you're a survivor, but here are some things that are going to help you as a survivor. Right. And I think that that's incredibly important, even though it's only, I think it was 8 weeks long.
Right.
We went through it. So even though it was only 8 weeks, it was still 8 weeks of knowing that you were going to call me every week, going through each of the pieces of the Pack Health program. So now that I'm done, I feel a lot more confident.
Good.
That I know I'm going to keep exercising. I'm going to try to eat as healthy as I can. And there are some other things there that I know that I can continue to do, but it was because I went through the program that I understand how important some of those pieces were that nobody else is really talking to me about.
Right. Well, and for the lay person, we're really hoping that it's, that big of a help or more.
But for somebody that doesn't have that background and they're just deluged with all these drugs and you have to do this and you have to do that, nobody really gets down to the nitty gritty of, okay, all the drugs and all the treatment stuff is over. Now what do I do?
Right.
And they don't know that, wow, exercise is important to battle the fatigue piece.
Right.
And it's important to understand your insurance, and it's important to have good nutrition. Even though somebody may have just kind of skimmed over that during treatment, that's not the focus. The focus is to treat the cancer and have you come out in remission so that you can go on and live your life.
Right.
And I think that's why the PAC Health program is so, so important.
And I think engaging people at home, especially with cancer, it's just more relaxing. You can listen better. You can absorb it better.
I think that's right. Being at home, you're not inundated with all this other stuff coming at you.
Right.
You can sit down, have a nice conversation. The stuff that you all send out, the little box with all the little goodies in it. I mean, that way, I know that I read through every single one of them as soon as they came.
Great.
But then when we would have our conversation, I would pull out that little piece and jot notes down and write down some things that would help me after we had talked. Or maybe you might have suggested something. The one at the beginning where you said, what are my goals?
Mm-hmm.
And you said, write them on there and put a picture of your family, if that's, was one of my goals, put a picture of your family and stick it up on the bathroom mirror so that you look at it every single day. And that was helpful because then, I mean, in your mind that I wanted to stay alive for my family, but kind of seeing that every day just kind of beats into your head that, Liz, this is why you are working so hard.
Well, thank you so much for taking the time to do this. We really appreciate it, and I'm glad it was helpful for you.
Oh, you're so very welcome. I appreciate the opportunity to share my experience. And really, I know I've talked about it with other nurses, as well as 2 cancer survivors that I'm very good friends with. And I think it's something that, now they're many years out from the whole active treatment, so they're kind of already adjusted. But I think for somebody who is close to being at the end of treatment, even within a year of, and I don't know what your time frame is, but I think that first year as a survivor is really critical because it sets some of the goals and standards that you want to meet that you can then do for every year afterwards.
And we also work with patients during their treatment also.
Oh, you do? Okay. Okay.
So
luckily, knock on wood, I'm done for a while. I mean, I know it can come back, and I just have to thank God that I'm here and I'm getting healthy again. And if it comes back, it comes back. And then I'll call you guys again and say, can I be in the program again, please?
Well, hopefully it won't.
Hopefully it won't. Think positive.
Yeah.
I'm very, very happy that we were able to do this. And I do feel a lot better. So thank you, Barbara. Good,
good. Well, take care of yourself.
All right, I will. You too.
All right, we'll be in touch.
Okay,
bye-bye.